Welcome. Good morning, good afternoon. You're in the right place. You're here for the 1 p.m. Eastern, 10 a.m. Pacific webinar or CE course, I should really call it, Boost Case Acceptance by Adding Medical Billing to Your Practice. We're going to give it about another maybe 30 seconds. Crystal, if that's all right, before we get started.
Absolutely.
But just for everyone who's arriving, you're in the right place. Your cameras are intentionally on mute, and so are your microphones. But we do want this to be an interactive program. And so please use the Q&A or the chat feature with inside Zoom to ask your questions. And we're going to have ample time to address them at the end of Crystal's program. So we'll take, again, another few seconds here and then we'll get started. But you're in the right place. And again, we don't want it to be, certainly not me and other people here on the panel, just us talking to you. So we really want to encourage people to ask questions along the route of today's program. All right, Crystal, I'm going to get started if that's all right, because we're at a minute over at the top of the hour. I don't want to penalize all of you out there that are really prompt, like my colleagues Dan Hall and Jeff Daly. Thank you guys. So let's get started. You're here for the 1 p.m. Eastern, 10 a.m. Pacific CE course, Boost Case Acceptance by adding medical billing to your practice. And today our program is co-sponsored by Darby Dental and us here at CareStack. And you will receive 1 hour of CE credit at the end of the program. So how this is going to work, just so that everyone can be forewarned, and you can't say that I misled you, as at about 2 minutes before the top of the hour, we're going to provide you with a code that you're going to take back to CE Zoom and complete your certification process that you are here today for today's program. And that may require you to complete a quiz depending on the state and the accreditation regulations that are in place. So Crystal, do you mind advancing the slide if that's okay? We're going to get a quick commercial word here from our two co-sponsors, and I'm going to turn it over to Jeff Daly from Darby.
Sure. Thanks, Jim, and thanks everybody for making some time for today's presentation. At Darby, we're excited to partner once again with CareStack to bring Crystal's presentation around increasing case acceptance. And who doesn't want to learn a little bit more about how to get to those yeses? So, you know, the 5-second shameless plug about Darby is what you may already know about us, is that we partner with our customers to help keep their dental supply costs down. What a lot of practices are surprised to learn is that over the past 10 years or so, we've also been focused on building a suite of solutions to help our customers resolve the challenges that they tell us they face on a daily basis. So today that includes things like our partnership with CareStack, IT services, mechanical equipment repair and installation, a full surgical and implant offering, and more. And then finally, you know, just a reminder that for our entire, our entire 70+ year history, all of our account managers have worked completely remotely with our customers. So we hear from our customers that they really enjoy interacting with our team on a schedule that works for them and when it works for them, and eliminates some unnecessary foot traffic in the practice. So if you're interested in learning a little bit more about how we might be able to help your practice, definitely feel free to reach out to any one of our well-trained experts on the team. And Jim, I'll toss it back over to you.
Thank you, Jeff, for the introduction. And Crystal, if we can advance the CareStack slide quickly. Thank you so much. So we're thrilled to be here today to sponsor this event with Darby Dental, featuring Crystal May, who will begin here in a moment. The real brief background on CareStack, and hopefully most of you have heard of us by now, but we are a 100% cloud-based solution for the complete management of the dental practice. And we find ourselves working with two types of offices. The first is growing, ambitious, having success. They see technology as enabling that competitive edge, and they just don't know how to get there. They need a little bit of help. The second, unfortunately, they've grown frustrated and aggravated. They're kind of stressed out by managing this multitude of software subscriptions. It really puts a lot of pressure on the bottom line of the practice for things like patient reminders, onboarding forms, electronic claims, analytics. So let's go on. And these offices are suffocating by managing 5 or 6 or 7 different subscriptions that layer on top of their old colossal legacy software. And they just don't know what to do. They're so aggravated. So if you fall into one of those two buckets, what I ask you to do is stay on when Crystal's program is done. You're going to receive your CE credits code, And I'm not going to hold you hostage. It's not like you're on one of those tours of a timeshare. And I know, Dan, this happened to you where you wanted to do the dolphin tour, but they made you stay 2 hours to get that dolphin certificate, right?
It
We're
was
not
so
gonna do that
disappointing,
to you.
Jim.
You wanted to swim with the dolphins. We're not going to do that here at CareStack. But if you want to hear more about CareStack, hang on for 10 or 15 minutes and Dan will do a quick demo. So without further ado, I'm going to turn it over to Crystal, and please take it away for our program. Thank you.
Perfect. Well, thank you to Darby Dental and CareStack for having me here today. I'm loving the participation. I'm really excited to share this information with you. And Jim, can you hear me okay and see my screen okay?
Yes, we can. Yes. Yeah, the audio is
Okay.
good. Your thumbnail might be frozen, but we're okay with that. So please go ahead.
Okay, perfect. Just want to make sure you guys can forgive video, but you can't forgive audio. So I want to make sure you can hear me clearly and definitely get my message across. So first thing I just have to do before we get started, like we always have to, is give you the disclaimer that this is only for educational purposes and that the rules and regulations can be different for billing in every state. And it's important that you do look at your own state requirements. And then none of the codes I'm sharing with you today are obviously owned by me. So I have to do that disclaimer. But let me tell you a little bit about me and my background and why I'm so passionate about this and why I'm so excited to share this topic with you. So I started in medical billing. It's been nearly 20 years now. And I was doing medical billing for all different types of medical services. So ophthalmology, OBGYN, general surgery, just everything to do with medical billing. And about 15 years ago, I had the opportunity to switch over to the dental industry. And in Utah, you don't have to be a dentist to own a dental office. And so I was actually able to start buying practices and really do things a little differently. We were very comprehensive and we were trying to kind of look at things from a total health perspective. And I saw immediately that we were treating patients that had medical conditions that were being affected by the oral cavity. So we started billing medical insurance for these dental procedures. And it was hard, even being a certified coder and biller and having the experience I had, it was challenging because the technology wasn't there. We were not able, and Jim, did I lose you?
Yeah, Crystal, you're fine. We can hear you.
Okay, my screen just went blank. So you can hear me and you can see my
Yeah,
screen,
we can
okay?
see. Yep, we can see your profile. Yep, it looks great.
Okay, perfect. I'll just keep moving then. Sorry about that.
Oh, you know what? You just
anyway,
dropped
so
off. Your screen just dropped off. That's okay. So just keep speaking, and if you
Okay.
email me the deck, I'll present off of my deck for the time being. Go for it.
Okay, and give me 1 second here. My
I think
Sorry,
Zoom might have kicked you out, but
I think so. So you cannot see my screen, correct?
no. But if you send me your deck, I can present it. It's no problem.
Okay, perfect. 1 second here. Thanks for your patience, guys. We always have to deal with technical stuff. And I was just saying a few minutes ago, I happen to live in a really small town in the middle of nowhere, so I don't have the most reliable internet connection ever. And so I apologize for that. So Jim, that is just sending right now. So you guys will see my deck through Jim's screen in just a couple minutes. So give me a minute. But while that's sending, I'll continue to tell you a little bit about what we're doing here and why I'm so passionate. So we started billing for dental services to medical insurance, and our patients were blown away. We really started to separate ourselves from our competitors or the dentists down the street. And we were seeing huge case acceptance for these cases that were covered by medical insurance. And I realized I was kind of onto something, that patients needed access to this treatment, but they couldn't always afford the care that we were recommending. And so I built software and service and support around both medical billing and sleep medicine to help other dental offices be successful. So some of my bigger success stories include a patient who fell while walking, and he actually lost most of his anterior teeth. He actually hit his mouth on the bumper of a car. And when that happened, he damaged most of his anterior teeth. And what that would have cost him for restoration was nearly $40,000. And because it was an accident, because we could prove to the medical insurance that there was a medical condition that was caused by this accident, they actually paid for his entire treatment plan. And I realized I couldn't keep that information to myself. I couldn't let all these other patients throughout the country not have access to this type of care. And so I I built this company, DevDent, and a software to help offices do that. So that's who I am. We help hundreds and hundreds of offices throughout the country bill medical insurance specifically for dental services. So my expertise comes very, very specific to the dental side of medical billing. So I'm excited to share with you some of the main topics that, or categories or procedures that could be billed to medical insurance. And so for the duration of my presentation, I'm just going to kind of try to show you how you could get your patients access to the treatment that they need, the treatment that they want, by offering another form of payment. So while we wait for my deck to go through, Jim, I think you were going to ask a poll question to our audience.
Yeah, I'm going to go ahead and put a poll question out here in a moment. Crystal, thank you for bringing that up. And I'm still waiting. I'm going to try to open up a deck I have from you in an earlier version that I think will work.
Okay.
But I'm going to put a poll out here in a moment. I think what will really help us in this conversation is understanding our audience. So what role do you play in the dental practice? So look for that here in a moment, if that's okay. And all these answers they're anonymous. And it helps us guide us, right, Crystal, in having a more detailed conversation. So let me go ahead. I'm going to go ahead and post that in a minute, but I have your deck up here. If it's all right with you, I'm going to go ahead and I don't know, you're not going to be able to follow through though. That's because you can't see your screen yet.
That's okay.
Okay, so let me present my screen. I think you're back now, right? I'm just worried about the orientation of this. So here we are. I'm going to go ahead, if you want to go ahead and can you see my screen okay? Crystal, can you see my screen?
We can't hear you, Crystal. I think you might be muted.
Okay, can you hear me now?
Yes.
Man, you would think after the COVID pandemic, I would be more efficient at this because I've only presented 5,000 webinars in the last 12 months, but this is very frustrating. So I'm very, very sorry to those of you. You've taken the time to join us, and I will make sure you still get all the information that you came here to get. And so thanks for your patience with our technology issues. So Jim, I'm going to share my screen one more time. And
sure, give it a shot.
You've got my deck.
Yep, I'll stop sharing, but go for it. See if it will come back up.
Yep, let's do that. It says I'm not able to, it's been disabled. Can you reactivate my screen share?
There you go. It's all set. Go for it.
Okay, let's just try this one more time and we'll see if we can get through it.
Okay, it looks good.
Okay, we're gonna get back on track. So you might be asking yourself, why would I bill medical insurance? I already don't like billing dental insurance, and it's already maybe an obstacle that you face in your practice. And so I kind of just want to explain to you why I think this is so important. We know that if we can decrease a patient's out-of-pocket portion, they would be more likely to accept the care that we need. And we know that patients are prioritizing their treatment based off of the dental benefits that they may or may not have. And so I'm going to suggest that we look at medical first, because we could leave that little precious dental benefit for future dental procedures. So your class 2 fillings, your single tooth restorations, let's let dental pay for those, but let's let medical pay for anything that we can prove medical necessity for. I also see so many offices that are not billing for what they're doing. We're talking about the x-rays you're taking, the cone beams that you're not billing for. Even a lot of your follow-ups and exams are just not being billed to anyone because dental insurance doesn't pay for them. But when you bill medical, they do. Medical has no maximums and frequency limitations when it comes to individual procedures. So you're not going to have that pano that's only allowed now every 5 to 7 years, or you're not going to have that perio treatment that was, not, the pockets weren't deep enough, and so they're not going to pay for the perio treatment. That's just not how medical insurance works. And then, as I mentioned earlier, one of the things that billing medical insurance did for our practice was separate us from others. There is a lot of competition in the dental space. We all know that. There's plenty of patients to go around. I certainly don't think we're struggling to find a need. But if you've got a group of dentists and one of you bill medical insurance and one of you don't, patients will choose the one that offers the more comprehensive payment option. So with that being said, why wouldn't you bill medical insurance? And the answer is because it's hard. right? It's because you don't know what you don't know. It's because you don't have all the tools to do that. And so I just want to kind of shed some light on what can be built so that you can maybe see if it's worth the time and effort to dig into this. So I've broken all of dentistry into 6 categories. And so this isn't specific to the industry. This is my own way to organize this information. So I'm going to go through each of these 6 categories. And by the time I'm done, I will have identified multiple procedures that every single one of you would be providing for your patient. So again, every dentist in the country is doing something that could be built to medical insurance, and you'll see what I mean. So what can you bill for? And one of my favorite statements, and I've been using this slide for 7 years now, everything. You can bill everything to medical insurance if you can prove medical necessity. And it's because it's not about the procedure, it's not about the what, it's about the why. It's about why you're doing it. So I get often asked, are single tooth implants covered by medical? I don't know, depends on why you're doing it. So it's not the procedure code, it's the treatment reason. If you can prove medical necessity, I've even personally had veneers paid because of tetracycline use. Think about that. A cosmetic procedure in our mind was covered by medical because I could prove that the medication they were taking affected the teeth. Okay? So there's really no limit to this if we can prove medical necessity. So I'm going to show you some of the questions we would ask. So there are 4 questions we can ask to kind of quickly decide if we can prove medical necessity. The first one is, does the patient's oral condition affect their health? Okay, so does something going on inside the mouth affect the rest of their body? An example of that might be periodontal disease, an abscess. I think we could all agree that if you have an active infection and an abscess in your mouth, it is affecting the rest of your body. Or maybe the inability to chew and have proper digestion. And the second question is, does the patient's health or medications affect the oral cavity? We see that all the time as well, right? We have our diabetes patients. We have patients with severe dry mouth due to medication. You better bet that that dry mouth caused by medication is affecting their oral cavity. That would be medical necessity. Is there a lack of function? So do they have impacted teeth? Is there atrophy? Can they not chew? Are they in pain? Those would all be function. Or are you screening for a medical condition? And this would be our oral cancer, our pH testing, your A1Cs, things of that nature. So very high level, if you can answer one of these 4 questions, yes, then you likely have a medical billing opportunity.
Crystal, before we go ahead, I have the results from the poll, if that's okay.
Okay, perfect.
And so I will abstain from any political jokes today, but the polls are closed. And it's interesting. It's a dead heat between office managers and principal owner dentists. And then kind of secondary to that would be insurance coordinators. So your mix is kind of like 45% between office manager and principal or owners.
Perfect. That's really helpful. And I commend you all for taking the time to be here. And those of you who are providers, I have to give you a little bit of extra credit because to take the time to learn about something in the billing category isn't always top of list for owners and dentists. And this is not something that you can say to your team, go do this, and I'm not going to participate in any way. There is going to be a little bit of effort from the dentist and then from the hygienist and from the entire team. And so I do commend you all for taking the time. And again, a little extra credit to those providers who understand that you play a pretty important role in billing in your practice as well. So this is great information. So getting into this first category, exams and x-rays. So this is going to, in this category, we're going to capture exams, whether you're talking about follow-up for treatment or a patient who comes in because they've had an accident or a patient who needs to be seen more regularly because they are diabetic. That would be a medical billable exam. If you treat sleep in your practice and you're seeing those patients to talk about their sleep and talk about their medical history, that would be an exam. You can bill for after hours and emergency care. Think about that. In dentistry, we have a tendency to do those for free or for less, and medical insurance is saying no. If you're seeing patients after hours on an unplanned appointment, it's actually worth more, higher reimbursement. You can bill for 3D images and 2D images. So your panos, your bite wings, your PAs. I don't know how great you guys feel about the 7 to 10 year pano frequency limitation. I think it's ridiculous. This would be an opportunity to still be able to do the panos on a frequency you felt good about by billing medical insurance. Here's just some examples of explanation of benefits, so you can kind of get some fees in mind. This is a new patient office visit. It was billed at $250, so that was the fee the provider put. The insurance allowed $124 and was paid $84, so the patient had a $40 copay. But when's the last time you were paid $124 for an exam? And I would argue never, unless you are a fee-for-service office. You've never been paid $124 for an exam. And Jim, I think I just got kicked out.
You're back. Try presenting again, Crystal. And if not, I'll go. I have your deck on standby. You're on mute, though. You have to unmute your phone line.
All right, I've unmuted. I'm resharing.
And I've got it available in PowerPoint if we need to. Let's give it a second to see if it comes back up, though, okay?
All right, can you see my screen?
We can't, so let me go ahead and jump to that slide that you're on there, and I'll present from my screen. If you just want to keep speaking to it, just give me, okay, and then I'll present it.
Okay. And I cannot see your screen.
Yep,
at all,
I need a
Jim.
second here. You got it. You're too
Oh,
fast.
okay,
for me.
sorry.
No, it's okay. You're
I'm
good.
like,
You're
okay,
good.
I don't see it.
Okay, so let me just go in. Does this look good to you? We're in the right slide?
I can't see your screen. Now I can. Yep,
Okay.
that's the right side. Yep.
Okay, now I just got to put it into presentation mode. Okay, so go ahead, and I'll try to do my best here and advance it. I'm just trying to figure out how to advance the slides here within Zoom, but go ahead, keep speaking, please.
Okay, perfect. So again, this is an office visit. This is something you're doing already on your patients. I'm not suggesting that you need to add new types of services or new types of treatment to your practice to bill medical. Just looking at what you're already doing and how we could potentially be reimbursed for those services. So the next slide.
It's weird. It's got me in some kind of, let's see, let me just, this might be better here. Let me see if I can just do this. Okay, there we go. Is that better?
That is just loading right now. Let's see.
Jeff and Dan, can you see the screen okay?
Yeah, that works.
Billing for radiographs
Yes,
is up.
Yes, okay. Okay, again, you guys, I'm so sorry. Super patient of you to work through this with us, and I'm sorry that we're having these technical issues. At the end, I'll have a suggestion if we don't get all the way through this, or if we need to re-record this and provide it back to you in a recording, I'd be happy to do that. So billing for radiographs. Why would medical insurance pay for radiographs? These are just some of the most common reasons, and I pulled these directly from medical policies. If the patient's in pain, if they have bone loss or atrophy, if there's an infection, many plans will actually pay for radiographs for implant planning. So just know that doesn't take a whole lot to prove medical necessity on a radiograph. One of my favorite reasons to bill for radiographs is we are getting those CBCTs that are denied by dental. We're getting low allowables if they are allowing for cone beams. And then of course we have our frequency limitations. So the next slide, this is just to talk to you about those of you that have cone beam technology. So many offices I talk to aren't billing for their cone beams at all. They're using the technology or it's collecting dust, and they're just not getting paid for these very expensive pieces of equipment. And so it is in my opinion that CBCT will be the standard of care, and it's important for you guys to know if you have this technology, medical insurance is paying for them. And then this next slide is just an example of that. So you can kind of get some fees. This this example, they allowed $385 for their cone beam. So this is a major payer. They paid out $251. And so this, again, much higher allowables. And this particular claim total was $11,000. So this is medical insurance paying dentists to do surgical procedures in this example. The next slide is again showing you another example of office visit and cone beam. One of the most common questions I get is how long does it take to get paid by medical insurance? And this is why I have this example here. This was billed on 6/11. That was the date it was submitted. We had a payment by 7/5. So understand that's faster than you're getting paid on probably most of your dental claims. So that negative concept that medical insurance takes forever to get paid isn't always the case. If you bill with the right code, you submit correctly, and you're credentialed appropriately, claims can be paid in under 30 days. So the next slide is on the second category, which is screening and diagnostics. This gets a lot of people excited. This is a pretty common area of interest, and this is because these are things that you might be doing in addition to your normal practice. So these are your smoking cessation, your Botox, your A1C testing, anything you're screening for. And a lot of our dental insurances aren't covering them. And so another great opportunity to look at medical. Under this category, I also have periodontal treatment. And so on this next slide, I've shown you what some of the reasons they would consider perio as a medical necessity. Because again, remember, this isn't about the procedure code. This isn't about what you're doing. This is about why you're doing it. So all perio treatment will not necessarily be covered by medical insurance. But if you have a patient who's pregnant or is diabetic, you better bet that we can prove that their medical condition is affecting their oral cavity, and their oral health, their periodontal disease, is affecting the rest of their body. And who more important than a pregnant patient or a diabetic patient to get that treatment? So again, we ask these questions. What is the medical necessity? Is this an oral condition that's affecting the health, or vice versa? And a treatment like this, we would bill the SRP, we could bill the Arestin or the laser treatment, and the ongoing perio maintenances. So once you open that door with perio, it really can be a huge benefit to your patient. On this next slide, again, I'm just giving another example of the time frame it takes and the amount of interactions it takes to get paid for, get a medical claim paid. Jim, did you advance that? There we go. This is perio maintenance. So we've got scaling and root planing and perio maintenance is being paid for by medical insurance. My next slide is the third category, and one of the topics I'm most passionate about in dentistry, and that's sleep medicine. In my introduction, I mentioned briefly that sleep is something that my company is also focused on, and it's something I believe every dentist should be looking at incorporating into their practice. I feel like airway and sleep is going to become a necessity for us in our industry. But sleep and TMD appliances are paid for by medical insurance. We get this conversation or question every day. Are occlusal guards covered? How do we prove that? And if the patient is suffering from pain, dysfunction, has TMD, we can look at medical insurance, and even your habit correcting devices, palatal expanders, and we've even had clear aligners paid for by medical insurance. Again, we can prove the medical necessity. I can't ever be in front of any audience and not take a second just to identify how critical sleep treatment in dentistry is, not only for your practice to have this ability to generate revenue and to do this, but for your patient. The ADA came out in 2017 and put in a policy suggesting that all dentists should be screening patients for sleep disorders. So this doesn't mean you have to treat them, but they're asking you to screen them, identify the risk factors. The next slide is all about how sleep affects the entire body. And if you aren't familiar with some of these statistics, you could spend 5 minutes Googling them, and you would see that they have linked sleep apnea and poor sleep to almost every major medical condition there is. So the hypertension, the heart failure, the stroke, diabetes, pregnancy-related issues, dementia, Alzheimer's, you name it. There's just about a study on it, and you can't go anywhere. You can't even get on an airplane or open a single magazine without seeing some sort of article about sleep or airway or someone who died untimely because of a sleep disorder. So if you aren't considering treating sleep in your practice, I would just really encourage you to ask what it would take for you to add some screening questions to your medical history and potentially identify a patient who has an underlying sleep disorder. You can change their lives. I mean, you can save them, you can change them. It's a really valuable service, and medical insurance is paying for it. So lots of people are scared about billing sleep appliances to medical insurance because there are a fair amount of documents required. You do have to have a patient who's been diagnosed with obstructive sleep apnea, and that has to be done by a board certified sleep specialist. They do have to have an interpretation. They do have to have a prescription and some paperwork. So the great thing about it is if you follow the rules and you have this documentation, sleep appliances are one of the easiest procedures to bill for. It's a single code, both diagnosis and treatment. So this next slide is an explanation of benefit on a sleep appliance. This is very average. This is a $2,900 allowable, and the insurance paid $2,000 after the deductible. So the patient saved $2,000 for their sleep appliance because you were willing to collect those pieces of paperwork. That's it. That's your entire responsibility to get patient this treatment. This next slide shows, again, what it takes to bill it. If you look on that right side and you see those orange and green and blue lines, each one of those is an interaction between the billing company and the insurance company. That's how much it took to get this claim paid, right? Back and forth, back and forth. They want something, we send something. So it's not always super streamlined, but even with all that correspondence, we got that claim paid in less than 30 days. And you can see the allowable on there is $1,950. So that $2,000 to $3,000 range is pretty average nationwide. Okay? The next category is trauma and accident. And I would argue that every single one of you has accidents in your practice that you don't even know about. If you haven't asked the question, how exactly did this happen? You've probably missed some pretty significant opportunities to identify an accident. And the reason I love this so much is because when you bill, well, that sounded kind of morbid, right? I don't love that patients have accidents. I don't love that they're hurt. But what I love is when they do have an accident, medical insurance kind of opens up this wide range of coverage. And what they say is they're going to cover everything related to the injury. The exams, the x-rays, the anesthesia, the temporary treatment, the surgical, I mean, all of it. If you've got to place an implant, they're going to pay for the implant, the membrane, the bone. They really open up coverage here. So you can save the patient thousands and thousands of dollars by looking at medical insurance when you have an accident. This next slide
is— Can I interrupt for a second? That's
yes,
okay. So we've got some questions coming in, and I want to remind everyone, we're going to finish like probably 8 or 9 minutes before the top of the hour and have a Q&A with Crystal. And she'll also provide her contact information. So post-course, if you want to interact, one-to-one, you can do that. So thank you everyone for the questions that are coming in. Sorry about that.
Perfect. Yes, no, please keep the questions coming, and I'll stay on as long as I need to answer them all. But we'll like Jim said, at the end of this, you'll have my contact information. Sometimes the questions are kind of deep, and we need to spend a little one-on-one time together to get your question answered as well. So I'm happy to do that. But talking about accidents, you may think you have to have a police report or an ER report or something to document this accident, and that's not true. We've created an accident form for our customers to use that's just a fillable PDF, and it literally says what happened, how did it happen, and how did it affect the oral cavity. And the patient signs it, and it becomes an accident report, and that's all we have to bill medical insurance for an accident. So just keep in mind, a fell while walking, a jumping on the trampoline and got kneed by the brother, the hit in the face by the softball, those are all accidents that medical insurance would likely cover, okay? The next slide is about the fifth category. This is probably the one that you most commonly associate with medical billing, and these are your surgical procedures. Many of you have maybe experienced already that dental insurance is denying impacted third molars. And they're saying that that is a medical procedure. That's a big deal. It's a big deal for those denials to start happening. And so we need to really open up our opportunity to bill medical for some of these things. This could be your implant, your grafting, your sinus augmentation. If any of you are doing any laser treatment, LANAP, CO2, those types of procedures are all billable to medical insurance. If you're doing IV sedation, we should definitely talk, because there's definitely an opportunity for you there. And of course, your all on 4, all on 6, full mouth reconstruction kind of services. So next slide is implants. And I joke about this, and I even when I call it out, like I'm going to, it still doesn't always get heard the right way. Not all implants are covered by medical insurance. It's just not the way it is. You have to prove the medical necessity, and there has to be plan coverage. A particular plan could say, we're not paying for implants, and it could be an excluded procedure. And it doesn't matter if we can prove medical necessity or not. It is a denied procedure because it's not a covered benefit, okay? But when you look at this, here's some of the reasons that you could have implant coverage. Did they lose the tooth because of a medication? Did they lose the tooth due to a medical condition, or was there trauma? So those would be medical history reasons. Oral conditions. Did they lose the tooth because of periodontal disease? Did they lose the tooth because of an infection? And can they not function because of it? So those are the arguments we're going to make. We do have a few policies that actually guarantee implant coverage. So it's the same way I said they might exclude it. There are some policies out there that say we offer coverage for implants. So it's all about the policy. Next slide is on bone grafting. Very similar. There's a medication that caused the loss of bone? Is there a medical condition that caused the loss of bone? Was there trauma? And when we document it, we have to document the severity of the atrophy. If you think about atrophy for a second, just understand that if you had atrophy of any other part of your body, right, if you just all of a sudden had lack of bone in your wrist, medical insurance would cover that. And so we just have to show them that there's a lack of bone or loss of bone because of this missing tooth or because of this extraction, and we will often get bone grafting coverage. So it's one of the easier ones to bill as well. And my next slide is just some examples of those. So these are implants and bone. This particular case was $2,300 was paid. Patient portion was $1,500. So we saved the patient $2,300 by being willing to bill medical insurance. Now, if we would have billed dental for this, they very likely would have covered part of the implant. They may or may not have paid anything for the bone, but they would have used their entire max benefit. And if you recall at the beginning of my presentation, I mentioned, let's leave those dental benefits for dental procedures. Let's not use that entire dental maximum on a single tooth implant, which is what would have happened in this scenario. My next slide is about, as another example of implants, EOB, this one, they allowed $1,139. Now that may be considerably less than you want to be paid for an implant. Your implant might be, $2,000. Because you're non-participating with these plans, you can still balance bill your patient. So you're not making a decision to say, I'm going to accept this allowable and this is all I'm going to get paid for this service. So you can still balance bill to your full fee. This next slide is a bone grafting example. You'll notice the allowables on bone are quite high. This is $1,000 for a single site. We're not getting anything near that on the dental side, right? And it's per quadrant. So huge opportunity here, both for your patient and some revenue generation. This next slide is for wisdom teeth. They pretty much have to be completely bony impacting. If you have a partial, you may have some coverage opportunity, but what medical insurance is saying, if they're complete bony impaction, we understand or we believe that the patient does have a development problem. They're saying the tooth didn't erupt the way it was supposed to, and they're considering that a medical condition. But again, it doesn't matter if the patient's in pain, it doesn't matter if the patient has infection. If you don't have that complete bony impaction diagnosis, you very likely won't have coverage for third molars. Here's an example of an explanation of benefit for third molars that was denied by the dental. The dental said, nope, no coverage. You need to bill medical insurance. The next EOB I have is that same patient we billed medical insurance for, and they paid 100%. So a lot of you might be getting these dental denials and you're frustrated and you're thinking, well, what am I supposed to do with this? Or you might even be saying, I'm just going to bill medical to get a denial. And I'm going to challenge you to look at this a little differently and say, why don't I bill medical to see if I can get payment? Because we just got 100% coverage for both the sedation and the 4 extraction, saved the patient $2,159, but you would have used that patient's entire max benefit on those 3rd molars. So you really saved the patient far more than the $2,000 by doing it through the medical policy. All right, my 6th and final category is systemic related procedures. This is one of my favorites. I say that a lot. I think I might like this topic a lot, but this is one of my favorites, but it's one of the more challenging. And so this usually gives you goosebumps, makes you feel really good when you can help these patients, but it is more challenging. We have to prove the medical necessity of this. So this is when we say there is a medication that caused dry mouth. The patient had cancer treatment and the chemotherapy has affected the oral cavity. The patient has GERD and that acid reflux has damaged the teeth. Maybe this is a patient who has an immune disorder that's affecting it. Maybe it's a patient that has some eating disorders or even some drug use, and it's affected the oral cavity. So we often have to involve a medical doctor when we work in this category because you can't diagnose these patients, okay? This next slide is just giving you some additional examples of that. So dry mouth, GERD, this next example I give you is ameliogenesis imperfecta, epilepsy. Removable dentures are contraindicated for an epileptic patient. So if you have an epileptic patient and they need a denture, we can actually bill medical for the implants to support that denture. So I feel like that's a pretty big advantage to those patients as well, right? That would be a game changer. So this next example is something I use often, and I have probably, maybe a few hundred of these cases that again give me goosebumps and make me feel all tingly and good inside. But this is a pretty impactful one. This young patient came to the practice and she suffered from ameliogenesis imperfecta. Hopefully none of you have personal experience with it, but you've likely seen it at very least in dental school. Her teeth were literally falling out in pieces as she came into the practice. So tooth by tooth, piece by piece, just deteriorating. She was in high school, so severely depressed that she actually was put on suicide watch. If you can imagine the stress of being a high school student on its own, and then add the fact that your teeth are falling out, right? That's pretty impactful. We were able to bill medical insurance for her procedure. We had all of her teeth were removed and she had an implant supported denture, upper and lower. And this next slide is our final product. And this cost the patient nothing. So again, this is why we do this. And I keep using this, but I would challenge you all to ask yourself, if you could help one patient in her situation, in your entire practice, for the lifetime of your practice, would it not be worth the effort to learn how to do a little bit of paperwork? And I don't mean to minimize medical billing. It is challenging. There are some things you have to learn and some rules you have to follow, but wouldn't it be worth it? And what if we could help more like maybe a couple of those patients a month? Here is another example, different patient. $23,000 is what this full mouth reconstruction was billed for, and they paid $21,000. So we just saved this patient $21,000 and were able to restore a majority of their oral cavity with implants and crowns. So hopefully I've seen the opportunity. Hopefully you've seen that there is procedures in your practice you're doing every day that could be billed to medical insurance, but you might be asking, well, how do you do it? What's the process? And I couldn't in an hour share with you everything you need to know, but I wanted to give you a high-level overview. So this next slide shows you the step-by-step process, just very simply. We get a copy of their insurance card. We contact their insurance and do a verification of benefit. We present to the patient based off of that estimate. If the procedure requires pre-authorization, we do the pre-auth. Once the pre-auth is approved, we complete the treatment and we then submit the claim. And that is important to note. You cannot bill medical until the procedure is complete. And then we age the claim until paid. And that is very simply the process. I wanted to give you a little bit more detail on some of these steps. So this next slide is the verification of benefits. And these are just some examples of the questions we would ask. We would find out if the policy is an HMO or a Medicare or Medicaid policy. We'd get their remaining deductible. We'd find out if they have any plan exclusions, as I mentioned on implants. Maybe they have a plan inclusion or exclusion, and there is no coverage available or great coverage. We find all of that out on the verification of benefit, and we do this prior to treatment. This next slide is the pre-authorization slide. And Jim, I think if you'll click one more time for me, it looks like, go ahead and advance one more slide.
Yeah, okay,
Yep, there we go. Yep, perfect. So these are some of the things we do at the pre-auth stage. Now, in dentistry, we have to support our claim, right? We have to prove that we have all of our documentation and our PAs and our perio charts at the claim stage. In medical, we do it at the pre-auth stage. So we actually give them all of our chart notes, all of our radiographs, our referral letters, our accident reports, whatever it is we need. We do that at the pre-auth. That means that when we get these pre-auths back, they're not ironclad. Of course, they could always still change their mind. But when we have an approved pre-auth, we have a pretty solid guarantee that they're going to cover the claim. And so we do that work in advance. It takes about 2 weeks to get a pre-authorization back from a medical payer. So next slide. Now you're probably thinking, okay, we did the verification of benefit, we did the pre-authorization. That's not that unique to dentistry. We do those all the time. A little different process, but not much. But how do we submit these claims, right? We know it's not the same claim form. It's not the same clearinghouses. It's certainly not the same codes. So there's 3 options. First is paper claims. I would shy away from this option. I wouldn't suggest you go spend a lot of money on a software to fill out paper claims or anything. And that's because very few payers are accepting paper claims anymore. They've all gone the way of electronic. This is also the easiest one to make errors on. It's the slowest processing time and can just be the most challenging. So paper claims is an option. The next option is payer web portals. And this means that your payer has set up an online portal where you can actually go submit claims directly to them using their portal. There's also a few national portals that will submit to multiple payers. The problem with this one is, though, you have to do all the coding on your own, so they don't provide any coding support. You have to know the codes and add them manually. You also have very little follow-up available. So when you submit to that portal, they don't come back to you with a response to tell you they've received it or any tracking. So this can be done. It's time-consuming. It's free, so that's appealing. But if you're doing any volume at all, the payer web portals probably won't work for you. Also keep in mind, not all insurance companies have them. So you may find a payer that doesn't offer that as an option, okay? And then the third option, and I'm a little biased, but the third option is to use a third-party company. And I really don't care which one you use. But if you use a third-party billing company, they will help with the coding. It will save your team an immense amount of time. They're the experts. So you have certified coders and billers who are helping you with these claims. So again, it'll take a long time for your team to be up to speed to the level that someone like I am. I've done this for a long time. But you get to have the follow-up outsourced. And I'm sure for all of you team members who are participating on this and are watching this, you're saying, I don't have time. I don't have time to do follow-ups. I don't have time to be on the phone with more insurance companies. I just don't have time. And that's what outsourcing to a third-party billing company can do, is not put that pressure on your team.
So Crystal, next slide. We've got about a 2-minute warning for you, okay? Did we lose you, Crystal?
All right, can you hear me?
Yes.
Okay. This next slide is credentialing versus contracting, and it's just something basic you need to understand. You will need to credential with medical insurance, and that just means that they have you on file as an office who's billing medical insurance. The contracting means you've signed a contract and you've agreed to their fees. So don't get the two confused. And you're not required to contract, but you are required to do the credentialing paperwork. This next slide is a resource that my team created for dental offices. You can go to debdent.com and you can find this credentialing checklist. So this is a checklist that can be used to make sure you have all the information. And I have a step-by-step recorded webinar there. So this is free to you. Go look at the webinar, use it if you're going to be billing medical insurance, and you'll be a step ahead most offices. So that's just our website. So in conclusion, we kind of talked about why we would bill medical. And so we need to ask ourselves, would more of your patients say yes to treatment if we could decrease their out-of-pocket? Do you have large cases that patients are struggling to say yes to or are walking out your door? Are you writing off or not charging for services? Are you a PPO provider on dental insurance and your fees are lower than you'd like? I don't know about you, but we practically lost money on bone grafting when we were on some of those fee schedules. And do you want to separate your practice from others? Do you want to provide a service for your patients that they might not get elsewhere? And if you say yes, I think medical billing is right for you. As Jim mentioned, I wanted to make sure you had my contact information. If you have any questions, you can go to our website, which is debdent.com. We have a few hundred recorded webinars that are available to you. They're all free and open to the public, similar to this presentation, and then into details. We break down myofunctional therapy and Botox and sleep and a number of different types of procedures. You can go there and watch any of those webinars and find out a lot more information about the services that we provide. And I'll leave you with my last slide, which has my contact information. You can email me at support@debdent.com. We have a fantastic team of customer service and support reps there that can help you. And we've also created a Facebook group. This is a non-sales group. This is an education group, and it is just medical billing for dental practices -Imagine Billing. We have about 5,000 dentists and dental team members on this group. We're just sharing each other's successes and struggles and how is medical billing working. It's very specific to the industry, and you might find some great resources there as well. So Jim, that's the conclusion of my presentation. And again, I want to thank you all for staying on and dealing with my technical issues. I'm so sorry that we struggled with that, but I hope I was still able to provide to you some valuable information and at least get you thinking, what would medical billing look like in my practice and what types of patients could I help?
That was great. Thank you. I mean, you handled a lot of the obstacles very, you navigated them well, like a true champion. So don't worry about it. We do have some questions. It looks like, Dan, you were monitoring them. Let me go ahead and grab them up here. Give me 1 second, Crystal, because I want to make sure that we get to them. Give me 1 second. I've got so many different screens that I'm managing.
Do you need some help, Jim?
Give me 1 second. Here we go. Okay, here's one from the audience, and I want to really just go ahead and encourage people to ask questions. So this first one is, do you have to be a participating provider to bill medical insurance? Maybe we can cover that one.
That's a great question, and one of the most common I get. So you do not. So there are different types of medical insurance policies, just like dental. There's PPO, there's HMO, there's Medicare, there's Medicaid, there's a long list. Some of them you have to be participating in order to bill. And most of them do offer contracts for dentists. So most of them will allow you to participate if you choose to. But for the most part, I suggest you stay out of network. We've kind of been shackled to dental policies enough already. And the last thing I want to do is have you feel like you're going into more contracts and more fee negotiations. So you can build a general PPO plan and many even HMO plans as a non-participating provider as long as you're credentialed correctly. Now, your patients may get different benefits because you're non-participating. So if you're familiar with your own policy, you know that it's not uncommon to have an in-network versus out-of-network benefit be different. And so your patients will potentially have a slightly higher out-of-pocket cost because you're non-participating.
Great, thank you for tackling that. We have a couple more questions here. And again, this is your opportunity, guys. Crystal, if you want to share your screen again, let's try it. Let's put up your slide from your deck that just shows your contact information. One person asked about access to your slides. That's their intellectual property. So I'll let you kind of answer that. Is there a way they can see these slides or view them from your website? Well, I'll kind of leave that up to you to decide what makes sense.
Sure. So what I would probably, I wouldn't be able to share the entire slide deck, but what I would encourage is a lot of this information that we've gone over is available on our website in different webinar recordings and in different methods. And those, again, are available to you and are no cost to you. There is a webinar, literally medical billing for dental practices, and it goes through a lot of these in detail. But if there's a specific slide or there's something on a slide I can help provide to you, please feel free to email at support and just let me know what question you had. But unfortunately, I wouldn't be able to share the entire slide deck.
No problem. That's fine. Another question from our audience is, does Medicare cover dental treatments?
Another great question. Especially those of you that have senior citizens is a majority of your practice. That's going to be something you're going to have to consider. The answer is not much. They cover CBCT if you have an accredited machine. They will cover bone grafting. They will cover some extraction, and they will cover sleep appliances. That's, an exam. That's pretty much it. Now, if you are treating sleep, you may want to consider opting in for Medicare. It's a fantastic service to provide. Allowable from Medicare is going to be about $1,500 or less for a sleep appliance. But generally speaking, when my patients with Medicare come in, I let them know, no, there's not dental coverage available by Medicare. Although there was just some pretty big support from the White House indicating that Medicare may be forced to cover medical, dental, and vision in the, dental, vision, and hearing in the very near future. So be prepared for that. They will still require medical codes. They'll still require medical submissions. But what they're saying is they're considering opening up additional coverage. And that's just news as of this week. That's getting some traction. So that's fantastic for our senior citizens, if we could get them access to some additional benefits. So.
Yeah, thank you for speaking to that. One or two more questions. We got some ones coming in. This is from Jacques in the audience here. Give me 1 second to get to that screen. I am wondering if dental endoscopy would likely be covered with the systemic oral link, rheumatoid arthritis, diabetes, heart disease, etc.
Absolutely. So absolutely, we can prove medical necessity for that. That's a great question. We just have to have the documentation from the medical doctor that confirms those medical diagnoses, right? Because you can't diagnose rheumatoid arthritis, for example. And so what we do is we have the patient typically contact their healthcare provider, say, hey, I'm seeing a dentist for this procedure, and they need documentation of my rheumatoid arthritis, including a diagnosis code. And I actually have a letter I give to my patient that says what they need to say. If some patients, I take the lead and I contact the medical office. But we do find the patient's involvement is important. I think it's really important patients get involved in their own healthcare more than they already are as well. And so you can either call and get that code or have the patient request it. We don't have to have a referral letter, but we do have to have the diagnosis code provided by the medical doctor.
Excellent. Yeah, thank you for mentioning that. Okay, one more question here. I promise I'm not going to hold you hostage. You're going to get your code here in a minute for CE credits. I know that's coming. So last question. Can you bill the patient more than the medical insurance allows? I know you spoke this a little bit, but maybe you can provide a little bit more detail, Crystal.
Yeah, I think that's a really important question to answer as well. A lot of us think that we're going to be subject to this allowable and we're going to be somehow not be reimbursed what we want. And the benefit of being out of network is you are not contractually obligated to take those adjustments. And that's just insurance law. So you are required, though, to collect the amount that's allowed by the patient. And what that means is, let's say that you build a sleep appliance, just an easy example, for $5,000 because you were hoping the insurance would allow a lot. And they came back and they allowed $3,000, but they applied the entire $3,000 to the deductible. Okay? You can't write off anything below that $3,000 mark because it was applied to the deductible. You are contractually and legally obligated to collect from the patient the amount that was allowed or processed by the insurance company. The decision you have to make is what you want to do with that $2,000 difference. So when you build $5,000, they allowed $3,000. You must collect the $3,000. And I would strongly, really listen to what I'm saying on this one. There is no area that there's more I would say, ethical questions being done in medical billing than writing off deductibles and copays. It is insurance fraud. You should not be doing it. So whatever you plan to bill to the insurance company, you should plan to collect from the patient. So you can balance bill that $2,000 if you choose to. So you can collect $5,000 in total, or you can adjust to the $3,000 allowable. I hope I answered that question clearly.
Yes, thank you. Really thorough. And it's a perfect time. We're coming to our conclusion here. I want to really thank Crystal for a tremendous program. You persevered through some technological issues. No big deal. We got through the deck. It was great. Thank you so much. So really enjoyed the program today.